Hello,
All
good
right.
morning, Dr. Chen.
Good
Thank you so
morning.
much for being here to highlight and celebrate Careers in Aging Week. We at the um, Aging and Longevity Studies program at the university and the School of Social Work really appreciate you and your time and your work. Can you please tell us a little bit about your occupation and your role on campus?
Yes. First of all, it's my great honor to be part of this program. And I am Chen. I am a geriatric dentist. I specialize in dementia dental care and end-of-life care, and also the dental management for older adults with complex medical history.
Mhm.
Currently, I am an associate professor in the College of Dentistry, specifically in the Department of Preventive and Community Dentistry.
Mhm. That is really interesting. You mentioned end of life care and geriatric dentistry. You don't always think of those two disciplines together.
Right. Yes. Yeah. And this is the geriatric dentistry is the subspecialty in dentistry.
Mhm.
So there are not too many people specialized in this area. Uh, and more specifically, if we are talking about palliative dental care or end of life care, I think it's even less. So I start to develop this interest probably 12, 13 years ago, and then and I have a great interest with medically compromised patient,
Mhm.
as I mentioned,
Mhm.
and end of life care patient certainly is the one of the most challenging patient population in geriatric dentistry.
Oh,
So that's
absolutely.
why I'm interested in this area. Yes.
Wonderful. You mentioned that you started to transition into this area of dentistry about 12, 13 years ago. What inspired you to to get working in this subspecialty with
Well,
older adults?
I think many reasons, but probably the main reason is the challenging. I think
Mhm.
I like to be challenging. I like challenging.
Mhm.
Yes, and so as you probably are aware of, uh, you probably know that older adult is very different from the younger population, younger adult, and then they have a more complex medical history, and
Mhm.
oftentimes a lot of people take a multiple medication, which could potentially affect their oral health and also affect our care. In addition to these, a large proportion of the elderly individual, especially in those the age 85 or above, and they present with the physical limitation. And many of them also have a cognitive impairment. All of these may significantly complicate the dental management for these individuals.
Right.
So, and create a lot of challenges. So you always encounter some new patient or the patient you are not familiar with or
Mhm.
you don't have a lot of experience with, and then that create a lot of challenging for us. And then I enjoy these challenges
Mhm.
and,
And
because
you really need someone, a dentist who knows what they're doing, who knows these special needs of the aging population, especially that
exactly.
85 plus.
Yes, yes. And then because as I mentioned, uh, the medication can affect our care,
Mhm.
and many health conditions can also affect our clinical management. For instance, like dementia patient, a lot of them comorbid with the psychiatric issue. They
Right.
have a behavior issue. They're not able to cooperate to care, or may not be able to verbalize their chief complaint, or maybe locate the tools that is bothering them.
Right.
So that require a special skill and knowledge to work with these special needs population. So,
Absolutely.
mhm,
Absolutely.
right.
I'm sure that no two days are alike for you, but would you mind sharing what a day in the life of Dr. Chen, geriatric dentist, looks like?
Yes. And I am a clinician scientist. So in other words, that I work with patient, provide patient care. In addition to that, I also do research.
Mhm.
So when I'm in clinic, my day usually just start with the patient care. I see a large variety of patients, including a patient with dementia or other uh, with other complex medical conditions. And I finished my clinic, and then I will have a lot of paperwork to do. Like I need to write my notes,
Mhm.
or maybe develop a treatment plan. And
Mhm.
sometimes, if I have a question need to be clarified with patient's physician, I will need to contact them and to clarify their health condition, or whether they are a good candidate for planned the surgery or
Mhm.
treatment, other treatment.
Mhm.
That's my clinical day typically. And when I'm not in clinic, my days usually start with email. I check with email and then respond email from colleague, from student, from my
Mhm.
research collaborator. And after that, I will start start to write, either writing paper or writing grant.
Mhm.
Uh, for instance, right now we are working on R01 grant to understand the oral disease pattern and the impact and oral disease impact on quality of life in palliative care, and also try to understand how these individuals perceive their treatment need
Mhm.
and also their goal of care. So this require a lot of reading in planning, in writing. So I also have a lot of meeting because right now I'm leading two NIH grant, a project, NIH funded research project
Mhm.
that has a lot of issue, operational issue and daily issue that we need to deal with. Like I need to meet with my staff, also review the research data, and then provide feedback for them or provide guidance, or maybe answer questions from like our student research assistants. They
Mhm.
don't know what to do with a certain assessment. I need to respond to that. And then a lot of meeting a day. And then
Right.
after that, I will resume my writing or maybe development of the research assessment tool.
Mhm.
Yeah, and then and probably till evening or night, late night, something like that. That's my typical day.
It's your typical day. It's a
Right.
it's a lot, but certainly a good mix of clinical and really important research.
Yeah.
Um, so tell me why you think it's important for dental students in particular, or even maybe someone who's a general dentist, to really consider this type of subspecialty working with older persons. Why do you think it's important for them to pay attention to this population and study this population?
Yes, I think this is a great question. So we know that our population is aging, right? And then so as a result, we have a more elderly patient present in dental clinic. In fact, I think the current patient population is older than that, much older than that we saw in the dental school clinic probably 20 years ago. And in the meantime, elderly individual they keep their teeth longer. A lot of them keep their teeth. And less proportion of the elderly individual lost all of their natural teeth. In other words, they keep their teeth longer. So therefore, their oral health need increase as yeah, along with aging. Also, we discussed that many of them has a chronic health condition. They are polypharmacy. They have a cognitive issue. They have other social economic issue that can affect their access to care. So many of these issues are unique. For instance, like we talk about the cognitive impairment. Cognitive impairment is it's more common seen in the elderly patient, and particularly the prevalence will increase with the aging. So our study shows that among the elderly patients who attend the dental school clinics, among those age 65 and above, about 45% of these individuals present with some sort of a cognitive impairment. So as a result of that's a very high number, right?
Yeah.
Very high, right? So then many of these individuals, as a result of the cognitive impairment, their clinical decision-making capacity will decline. They may not be able to understand the dental treatment plan conversation, and then they also may not have a capacity to make a treatment decision, right? Treatment decision. In addition to that, their ability to handle medication, dental-related medication, or maybe keep up their home care instruction also compromised. Right? So therefore, really need to have additional training or skill to appropriately address the oral health need of the individual, and also improve the quality of care.
Right. And you highlight this, I think, with your a little bit with the research topics that you shared with us, that conversely your oral health affects your quality of life too. You know, not only your socioeconomic status affects your oral health, but vice versa too. You know,
Right.
you want to go to a dentist that can take care of your teeth in the right way, so that will improve the rest of your life
Yeah.
as well, or
Right.
other dimensions of your life.
Yeah. I think another example to for dental professional to learn geriatric dentistry is that uh, as a result of the aging, especially among those oldies old, like age 85 and above, I think life expectancy really is an issue. And then in addition to that, the chronic health condition can further affect their ability to tolerate the patient's ability to tolerate the dental treatment.
Right.
And also their perception of oral health need may also change. This is especially true in the patient with the life-limiting health conditions such as cancer, advanced organ failure like congestive heart failure or COPD, those kinds of patients, right? So therefore, we cannot assume that the current practice guideline will automatically apply to those individuals.
Right.
And really need to be tailored of our treatment based on patients' value, based on their goal of care and their also health condition and also ability to tolerate dental treatment. So yeah.
Important, so specialized, and you mentioned that there's not many of people that do this work, but we certainly need more. So
Yeah.
thank you for that really thorough explanation.
Mm-hmm.
You earlier mentioned that you really enjoy the challenge of working with older people, older adults in this type of work because of the comorbidities and the challenge that brings to you as the clinician and the practitioner. Tell me, besides that challenging piece, that can be very professionally satisfying, what do you love most about working with older adults?
Well, I think maybe is the feeling of rewarding. The rewarding feeling, I think, is probably I love the most. I think these probably come to two different. The feeling, this type of feeling, the rewarding feeling, maybe come from two different sources. One is that from direct patient care. So, and as a geriatric dentist, we receive a lot of referral from general dentists from community. And because of the complex medical history or because of the behavior issue or something like that. So oftentimes that the patient have to drive like an hour, 2 hours to come see us, and because they was not able to find a dentist who is able to provide care. So, and then by working with this individual and helping them resolve the pain, the infection, to help them restore their oral function, I think it's really a great reward from a clinician's perspective. Right. So that's one piece of the rewarding feeling. Another thing is probably come from research. So, geriatric, as I mentioned, geriatric dentistry is relatively small area, and then not too many people are involved in this area. And as a result, that a lot of issues that are essential to ensure the quality of care or to hasn't been studied or well studied yet. So that provide a lot of opportunity for a person like me as a clinician scientist. So therefore, we can provide the evidence, valuable the information and evidence to help our colleagues to improve their management with the elderly patient with complex medical history or other special needs. So this also made you feel that your work is really valuable and rewarding. And I can give you an example here. So for instance, like I specialized in end-of-life care. And right now, there very, very few people are working in this area. And then in this country, we don't have any program, interdisciplinary program that include dental team. How to say that? Let me take it back. In this country, we don't have any interdisciplinary palliative care program that include the dental team. So in the palliative care team. So right now I'm working with the University of Iowa palliative care clinic to develop the very first interdisciplinary program that enable dentists to provide oral exam and oral consult to palliative care patient within the palliative care clinic. So I think this is very good. And in addition to this, we also conducting the multiple research project to understand the oral health need and also their treatment preference in patient receiving palliative care. And then many of these work are the very first study of this kind. So these will really help us to better understand how palliative care patients and also those who come to the end of life change their perception about oral health, about the value of oral health care, and preference of the treatment preference. So in other words, how terminal illness may reshape their personal value on oral healthcare and oral health. So I think and these information certainly will be helpful for us to better manage this patient and provide appropriate care to address their personal goal, to meet their personal goal.
Mhm.
Right. So
That's unbelievable. That's really great, really, really important work. You mentioned it, we can't emphasize enough that the population is aging. So a huge demographic shift that will need dental care, right? We're living longer, keeping our teeth longer. And so thank you so much for sharing your important research, your important clinical work. It's very exciting. It's exciting that it's happening here at the University of Iowa too.
yes.
So thank you so much for talking with me, Dr. Chen.
No problem. Again, I mean, it's my great pleasure to be part of this interview in this program. So yeah, thank you for the opportunity.